Okay, so we're gonna do a core stabilization exercise, pelvic floor strengthening. It's best done on a physio ball, but you can sit on your bed, at the couch, or a chair. Just try not to have your back completely supported, so you're not leaning into it. But you do want to pretend there's a wall behind you, so that way you are thinking tall and you're not hyperextended like so. You want to feel your spine kind of line up, shoulders stacked over pelvis, rib cage is trying not to be super flared if possible. The best thing to do is to just think feet flat on the ground. Imagine someone's pulling you from the crown of your head or your ears up and back. Relax the shoulders, relax the chest inward, soften the belly, and keep your shoulders in line with your hips so you're not too far forward or too far back. And then what you're going to do is keep belly soft. You're going to take a deep breath in. Rib cage expands, belly expands. You're going to exhale. Think about drawing the belly button to the spine in up and in fashion, super gentle. Once you have that down, you're going to start to slowly extend one leg straight and then bring it down. And then you can keep the abdominals drawn in and alternate, or if this is your first time or you're starting to do this exercise, I also like putting my hands on my hips. I can feel my hips sway and move, and I try not to do that. So I'm going to take a deep breath in. Exhale, keeping the thigh on the ball. Try not to sway a lot, but I'm wearing socks, so that's actually a little more of a challenge. I'm sliding, but try doing this barefoot. Actually, it's going to give you more stability in the weight bearing leg. So we're going to inhale again, and then exhale. Abdominals are drawing in. I'm feeling a little pelvic floor contraction, almost like 25% effort. Releasing the pelvic floor, releasing abdominals. Breath in again, and exhale. Okay, so this is level 1. Level 2 would be you actually marching. So it's going to be an inhale and exhale, shifting my weight, gently marching, bringing it down, relaxing belly, relaxing pelvic floor, reset, inhale. Exhale, belly button up and in. As you exhale, blowing out a candle, you're going to march the other leg up. Trying your best to maintain stability of the ball, not going far forward, back, hiking, anything like that. That is the challenging part. You're trying to stay straight while extending, changing positions. There's always going to be some sort of movement, but you're trying to minimize it. And then the other one is marching, okay? And when you bring this thigh up, it's a little more weight. And so what you want to avoid is pushing belly out to lift the leg up. Everything is subtly drawn in, almost like there's a rope, and you're pulling your leg or lifting your leg up using your core, controlling the lowering, soften the belly, then pull this leg, soften the belly, and then you reset. Okay?